Hello, everyone. I'm Nicholas Linas, and I had the pleasure of interviewing Tara Buehring over Zoom for this assignment. So, Tara currently works with the Orange County Healthcare Agency as an HIV planning and coordination program supervisor. But she started her work with public health in 2016 as an HIV community health educator with Planned Parenthood, basically offering education resources to the community there. Before joining Orange County Healthcare Agency, she also served as an epidemiologist for Oregon State's DPH and as a hospital infectious specialist here in LA with UCLA. As I mentioned, Tara currently works with Orange County Healthcare Agency, which is essentially Orange County's Department of Health. So she gets to work all over the community and she works within her office. So as a whole, OCHCA serves the community of Orange County and some of their neighbors as well, offering education and resources pertaining to health and wellness. The Department of Health's HIV Planning Coordination Department works specifically with individuals within the community who have contracted HIV or at high risk of contracting the disease, helping to limit the spread of the disease and reducing the impact for the community and the individuals involved. More specifically, their mission statement reads HIV PAC's mission is to prevent the transmission of HIV, to encourage early intervention for those who are aware of their HIV status, and to ensure that persons living with HIV have access to the needed healthcare and services. So I was able to ask Tara a little bit about how she spends her day to day, and she shared that a lot of her time is spent working with stakeholders in the community, such as physicians, people with HIV, and other public healthcare professionals to address community concerns regarding the disease. She also said that this helps her to better support the people that she serves and to hear what it is that they would like to see in the programs that they're starting to implement and work on. This for me perfectly embodied essential service number four, uh, because Terra is connecting with different community members and community sectors to provide pertinent and effective resources to those who need it, while also providing a stage for the community members that she serves and creating partnerships within the community. Tara also shared how she's constantly evaluating improving services that the program provides by collecting data, talking with community members, again, people with HIV, seeing what it is they would like to see from the programs that are being offered, working with the physicians that are working within the program, seeing how it is that they're actually presenting these resources and options to the people who it's supposed to reach and seeing if it's actually reaching and creating the desired effect. Finally, Tara is also working on Orange County's HIV outbreak plan, which has never been created before. And I found that actually really surprising, given that we do work in California. But she's creating it in hopes of limiting the spread of the disease should an outbreak actually occur. She'll say that this is really difficult for her right now because she's creating it completely from scratch and that there's no real framework for her to actually work on. And that this is kind of a new sector for her. So it's really interesting to see that even her, as a professional in this field, still is finding new challenges, especially in someone in her position. And finally, the 2 points that she kind of shared to me that really stuck out to me is the difference between finding peace of mind with work and the work that you're doing versus making the money. She shared that while working at a hospital, she felt very overworked and that the impact that she was making to the community wasn't as impactful. And it was a lot more about the money that the company was making, that the hospital was making, that the system was making versus the true care and impact that she was making on the people that she was supposed to be helping. Another thing that she shared that I found really important was that public health is always changing. There's always new information, always going to be new barriers. um, And sometimes those barriers are going to feel a little bit harder. She did share that right now with uncertainty on budgeting and healthcare allocations of that funding. It's been really hard to kind of pivot their planning and even create new programs because they don't know where or if money is actually ever going to come, or if one day the program could just be shut down altogether. So she said just to always keep an open mind and to just kind of work with what you have and try to make the most of it and be as effective as possible. But thank you guys so much for listening. Thank you.